If you're an employer, you already know this much. Healthcare costs keep going up. Employers are frustrated with their benefits. Employees are frustrated with their benefits. And no matter how hard you negotiate, nothing seems to fundamentally change. What most employers don't get is why. It's not because they're not smart, it's not because they're not paying attention, but because healthcare is one of the only major expenses where the people paying for it are intentionally kept from seeing how it actually works. This presentation is about pulling those pieces together, not to sell you anything, not to blame employees, doctors, or employers, but to explain clearly and honestly how employer healthcare actually functions as a system and why the outcomes you're getting are predictable once you understand the structure. How employers became the payers and why pricing broke employers. Employers didn't start paying for healthcare because it was efficient or well designed. They inherited the role during World War II. During World War II, wage controls prevented employers from competing on pay, so they competed with benefits instead. Health insurance became a workaround. After the war, that workaround didn't go away. The tax code locked it in. That single decision turned employers into the primary financiers of healthcare, without ever asking whether that was the right way to do things. No one explored whether employers were equipped to manage medical pricing, healthcare risk, or clinical decision making. It wasn't the right way, and employers weren't equipped to collectively manage a nation's healthcare. But once the structure was in place, everything else had to adapt around it. And that adaptation is where the problems begin. Before we talk about waste, overuse, or bad behavior, we have to talk about price. Because healthcare pricing, as most employers encounter it, isn't pricing at all. Hospitals publish charge master rates that have little relationships to cost. Insurance companies negotiate discounts off those numbers, creating prices that exist only inside contracts. That's why two people can receive the same service in the same building on the same day and be charged wildly different amounts. When insurance is removed and care is purchased directly, labs, imaging, procedures, the prices suddenly make sense, and they're dramatically lower. Same care, same clinicians, different payment mechanism. Once price signals disappear, markets stop working. And once markets stop working, costs spiral and not downward. That distortion sets the stage for everything that follows.